Hi, folks. We're just going to give everybody a few more moments to join the call, and then we'll begin. Good afternoon, everybody. My name is Laura Morell, and I work in the One Health Office of the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on March 4th, 2020. ZOHU call content is directed to epidemiologists, laboratorians, scientists, physicians, nurses, veterinarians, animal health officials, and other public health professionals at the federal, state, and local levels. Please be aware that CDC has no control over who participates on this conference call. Therefore, please exercise discretion on sensitive content and material, as confidentiality during these calls cannot be guaranteed. Today's call is being recorded, so if you have any objections, you may disconnect at this time. Detailed instructions for obtaining free continuing education are available on our website and will be given at the end of this call. These presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. The Planning Committee reviewed content to ensure there is no bias. CDC did not accept commercial support for this activity. CDC, our planners, presenters, and their spouses or partners disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. Before we begin today's presentations, Dr. Casey Barton-Baravesh, Director of CDC's One Health Office, will share some news and updates.
Hello, everyone. Thanks for joining us for today's ZOHU call, and welcome to all of our new participants. The ZOHU call audience continues to grow with subscribers representing professionals from government, non-governmental organizations, industry, and academia, including students. We appreciate your help in spreading the word about the ZOHU call, so please continue to share the ZOHU call website link with your colleagues from human, animal, environment, and other relevant sectors. The site includes links to past call recordings, information on free continuing education for a variety of professionals, and a link to subscribe to the ZOHU call email list. To begin today's call, I'd like to share some highlights from the One Health news from CDC, which was included with today's ZOHU call email letter. CDC's response to the coronavirus 2019 or COVID-19 outbreak is rapidly evolving. Please check CDC's website for the latest guidance and resources, including information about animals. CDC's Pet Disaster Preparedness Kit is also available on the Healthy Pets, Healthy People website. CDC's One Health Office has created a new email newsletter for the Healthy Pets, Healthy People program. A subscription link's available on the homepage. Please be sure to share that with your colleagues as well. We have new information about two conferences. We wanted to let you know that the 2020 Inform Conference has been canceled. It was previously scheduled for March 9th through 12th. The 2020 Preparedness Summit is still planned for March 31st to April 3rd and will be held in Dallas, Texas. We've shared links to recent publications, including CDC's Health Security Supplement with some lessons learned in global health security implementation, as well as a preliminary evaluation of human personal protective measures against the nymphal stage of the Asian longhorn tick. Some recent publications in the Morbidity and Mortality Weekly Report, or MMWR, that might be of interest include several on COVID-19, including the initial public health response, interim clinical guidance, and also the first stage of people evaluated for COVID-19 in the US. There's also one on Chagas disease and dengue that might be of interest. Regarding outbreaks, there's a new outbreak of E. coli infections linked to clover sprouts that's posted on CDC's website. And you can also visit CDC's website for updated information, travel recommendations, and resources related to COVID-19. A selected list of ongoing and past U.S. outbreaks of zoonotic diseases, as well as information on staying safe and healthy around animals, is always available on CDC's Healthy Pets, Healthy People website. The complete current CDC outbreak list, including foodborne outbreaks, is available at cdc.gov/outbreaks. And as always, if you'd like for us to share news from your organization, or if you want to suggest presentation topics or even volunteer to present, you just have to contact us at zohucall@cdc.gov. Again, thank you for supporting the Zohu Call and for joining us today. We've got an exciting lineup of speakers and topics. I'll now turn the call back over to Laura.
Thank you. Today's presentations will address one or more of the following objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Questions for all presenters will be taken at the end of the call. Please only use the Q&A feature in Zoom to send your questions. You may submit questions at any time during the call. Please name the presenter or topic at the beginning of each question. You'll find resources and links for all presentations on our website and in today's Zohu Call email. Our first presentation, Mammal Decline Linked to Invasive Burmese Python, Shifts Host Use of Vector Mosquito Towards Reservoir Hosts of a Zoonotic Disease, will be given by Dr. Nathan Burkett-Cadena. Please begin when you're ready.
Hello there. I hope everyone can hear me all right. Can we go ahead and go to the next slide? So how appropriate is it that we start off today's call by talking about a mosquito named Culex CDCI, pronounced CDCI, and this is named in honor of the Centers for Disease Control and Prevention. While I hope that most Americans have heard about the Centers for Disease Control and Prevention, the CDC, and utilize their resources, I doubt that many people will know about this mosquito. So this mosquito is endemic to the state of Florida. It's only known from the state of Florida in the entire world. It bites a wide variety of mammals, and it is the only confirmed vector of a virus called Everglades virus. Next slide, please. So what is Everglades virus? Well, Everglades virus is a member of the Venezuelan equine encephalitis virus complex. So this excellent map from a publication by Weaver and Barrett shows the geographical distribution of the different subtypes of Venezuelan equine encephalitis viruses in the Americas. Next slide, please. Everglades virus is type 2 of this family of viruses, and it is only known from Florida in the entire world. Go Florida. Next slide, please. So the transmission cycle of Everglades virus involves this mosquito, Culex CDCI, which is the only confirmed vector of the virus. Next slide. And certain rodents. So notably, these are 2 native rodent species in the eastern United States, the hispid cotton rat and the cotton mouse. Next slide, please. Culex CDCI is also the only confirmed epizootic or epidemic vector of the virus and transmits the virus to human beings. Next slide, please. So Everglades virus does cause disease in humans, or can cause disease in humans. The first case was in a 53-year-old woman living in Homestead, Florida, all the way down south of Miami, and this was published in the year 1970. Next slide, please. Culex CDCI, as we said already, bites a wide variety of mammals. How do we know this? Next slide, please. So we know this based on studies that were done in the 1960s and 1970s here in Florida by John D. Edmond, who was a faculty member at the Florida Medical Entomology Laboratory. And he used a technique called blood meal analysis to investigate the host use patterns of a variety of mosquito species, including Culex CDCI. So here we can see a list of host groups that this mosquito bit and the percentage of blood meals that came from each animal group. Next slide, please. So I've circled in red here rodents because we know rodents are important hosts for this virus, and rodents constituted about half, so 54% of the blood meals of this mosquito. The other 46% of blood meals came from animals like white-tailed deer, opossum, and raccoon. Next slide, please. So this is important because in any natural mammal community, some of the members of the community will be a competent host for the virus. Next slide, please. Like the rodents, which are indicated as potentially infectious hosts in this slide and all the next slides through this red shading. Next slide, please. So the vector mosquito chooses or feeds upon the available mammals or available animals in the community in some relation to their availability. Next slide, please. Theoretically, this translates into some calculable transmission risk for humans. Again, this is theoretically. Next slide, please. Well, this idea that greater biodiversity is associated with lower disease risk has been investigated extensively in the Lyme disease system, where researchers have shown that as biodiversity of mammals increases, the transmission risk for Lyme disease decreases. Next slide, please. Well, this is where the Burmese python comes in. So the Burmese python is a large, non-venomous snake native to Southeast Asia that has become established in South Florida through the exotic pet trade. Next slide, please. If you Google or you go on any web browser and you look for news of Burmese python in Florida, you'll find lots and lots of headlines of very large snakes caught by people in the wild. Here we have an alligator wrestling for its life with a Burmese python. Next slide, please. But you can start to understand the impact that the Burmese python can have on the native mammals when you see an image like this. A Florida python eats a deer bigger than itself. Next slide, please. A very nice study performed by Dorcas et al. Looked at the declines of mammals in Everglades National Park and how it coincides with the proliferation of the Burmese python. The green bars here represent the different groups of mammals that were studied before the introduction to the python. Next slide, please. The red bars, which are very small, show the mammal encounter rates of these same animals after the introduction and establishment of this python. So nearly all of these mammal species were undetectable after the python became established in Everglades National Park. Next slide, please. McCleary et al. Went a step farther, and they actually captured marsh rabbits, released them in the Everglades, and then tracked them to see what happened to these rabbits. Well, between 66 and 80% of the rabbits that they released died due directly to being consumed by the pythons. So there's a very solid case being made that the pythons are restructuring the mammal community in South Florida. Next slide, please. So we've gone from a situation with a natural community to the introduction of the python. Next slide, please. And we want to know, does this invasive predator affect Everglades virus transmission? Next slide, please. So this is where one of my master students, Isaiah Hoyer, gets involved with this story. The thesis title for Isaiah was Ecology of Culex CDCI in Vero Beach and Everglades National Park. And this photo shows Isaiah collecting this mosquito from a device we call a resting shelter in the field. Next slide, please. So Isaiah was working in Vero Beach and Everglades. He was collecting Culex CDCI from these locations, performing blood meal analysis on engorged females, blood engorged females, to determine which animals they're biting today. And he was going to compare that data, his current day results, to those of Edmund from 1979. So this is prior to the invasion and establishment of the Burmese python in South Florida. Next slide, please. So the map shows where the pythons are considered frequently encountered in red, occasionally encountered in orange, and rarely encountered in yellow. So this python is actively expanding its range in southern Florida. Next slide, please. And just to orient you, this shows some of the major metropolitan areas in Florida. So starting with Everglades National Park in the south, Mahogany Hammock is the name of the location we are working. Miami is within that area that the pythons are occupying. Fort Lauderdale, West Palm Beach, and finally Vero Beach. Pythons haven't made it there yet. Next slide, please. So what Isaiah found from Vero Beach is that Culex CDCI is feeding upon a diverse community of mammals. So this mosquito is taking about 60% of its blood meal from rodents. We know that it likes to feed on rodents, but is also feeding extensively on animals like rabbits, raccoon, and opossum. Next slide, please. In contrast, in the Everglades, we found that this mosquito is mainly biting rodents. So 90% or more of the blood meals that we analyzed for Culex CDCI came from hispid cotton rat and cotton mouse. These are the two reservoir hosts of Everglades virus in nature. Next slide, please. Perhaps most illustrative is to see how this has changed over time. So here we have a graph with the data from John Edmund's 1979 publication showing the distribution of blood meals from the various animals, the mammal species that this mosquito bit in 1979. Next slide, please. What we have on the right is the data from Isaiah's thesis showing the change in blood meals over that time period. So blood meals from cotton rat, which is an important host of Everglades virus, increased significantly from 1979 to the current day, going from around 15% of the total blood meals before the python to almost 80% of blood meals current day. So blood meals from these other mammal species, the deer, the raccoon, and opossum, declined significantly over this same period. Next slide, please. So we've gone from a situation before the python was introduced, where we have a natural community of mammals, the mosquito feeding on a diverse array of mammals, next slide please, to one in which the python has selectively consumed medium-sized and larger mammals. Next slide please. And this has resulted in a low diversity community where the majority of the available hosts are reservoirs for Everglades virus. And this has theoretically led to an increase in Everglades virus transmission risk in the areas that are impacted by the Burmese python. Next slide, please. So, does this invasive predator indirectly increase Everglades virus risk? To really be able to determine that, we need to capture mosquitoes or mammals and determine whether the prevalence of virus in the vectors and the host has increased over this time. So I'd like you to stay tuned, pay attention, because there is more work being done in South Florida to address this specific question. Next slide, please. In conclusion, the Burmese python continues to impact South Florida mammal community through predation. Reduction in mammal diversity is reflected in patterns of host use observed in the Everglades virus vector, Culex CDCI. Humans and wildlife may be at greater risk of Everglades virus infection and disease due to increased utilization of reservoir hosts by the vector in python defaunated areas. This research highlights links between diverse natural communities and the ecosystem services they provide, which may even have protective value for human health. Next slide, please. I really want to thank my co-authors of this work, Isaiah Hoyer, Eric Blosser, Carolina Acevedo, Anna Carroll-Thompson, and Larry Reeves. This work was funded by grants from the University of Florida and NIFA. Next slide, please. Thank you all for your attention. That concludes my presentation.
Thank you. Our next presentation, Companion Animals and Domestic Violence as a One Health Issue, is by Dr. Melinda Merck. Please begin when you're ready.
Thank you. Can you start with the next slide? First, I want to talk about some terminology. We talk about domestic violence, but the more widely used term now is interpersonal violence. And I found this from the University of North Carolina, where they tried to define the wide range of what we can be looking at when we talk about this kind of violence. And it includes physical, sexual, emotional, economic, or even psychological actions, threats of actions that a reasonable person in these similar circumstances with similar identities would find intimidating, frightening, terrorizing, or even threatening. And it's interesting, this is not just to oneself, but it could be to someone's family member, or they include the pet, and that's the key. It can be someone they're in a relationship with, or it can be someone they were in a former relationship with, or it's just someone that they live with. Next slide, please. We talk about the link, and the link refers to the link between animal cruelty and other forms of violence. And what we know is a wide range of things, where those that commit animal cruelty are 5 times more likely to commit violent crimes, 4 times more likely to commit property crimes, and 3 times more likely to have drug-related offenses. It's linked with child abuse, elder abuse, and domestic violence. We know it's also linked with sexual abuse of animals and domestic violence. Some is reported as high as 20%. There was a study done on juveniles, and they found that juveniles that drown animals or have sex with animals was the greatest predictor for that child to become an adult sex offender. Other studies, 41% of men arrested for domestic violence had this history of animal abuse. And it's been reported that there's an 11 times higher incidence of dog bites in homes where there's child abuse. Next slide, please. In the United States, 1 in 3 women and 1 in 4 men will experience domestic violence in their lifetime. This also is very similar in the world stats, where 1 in 3 women will experience domestic violence or sexual violence in their lifetime. Homicide rates are very similar worldwide and in the US, where 50% of female homicides are committed by an intimate partner or a family member. And in the US, similar, almost 50% of 47 major cities found that those were committed by intimate partners. Next slide, please. The pets in domestic violence and child abuse homes are at great risk. 71 to 88% of those pets will be threatened, injured, or killed. Domestic violence victims report that, in comparison to non-victims, 11 times more likely to report that the pet has been physically hurt or killed. And when we look at statistics in the United States for homes with pets, with 85 million homes having pets, that's an estimated 21 to 28 million pets at risk. This is the key and most disturbing statistic that we all need to be aware of, is that 45 to 65% of domestic violence victims reported that they delayed or did not leave without their pets because there was no place to take their pets. Next slide, please. We need to be aware that the most dangerous time for a woman to leave the abusive relationship is the most dangerous time is when they leave that abusive partner. 75% of those homicides occurred during that separation. And they also found that for a 2-year period after separation, there's a 75% increase in violence. Next slide, please. Animal abusers in interpersonal violence, some of the things we need to consider is that they may start with the animal and then move on to the physical abuse of the partner. They may use the animal or threatening of the animal to coerce the victim to engage in abuse in general, and also abuse of the animal, especially sexual abuse. They also may systematically kill the pets over time, even when they get a new one or allow their partner to get a new kitten or whatever it is, they will systematically kill those animals. So we need to be aware of this and look at the history of all animals from that same household. Next slide, please. Elder abuse is also a factor where 1 in 10 of those over 60 have been abused. They know their abuser. It's an underreported issue. And in another reporting study, that over 35% of adult protective service workers reported their clients had told them that their pets were threatened, injured, killed, or very often they're denied care by the caregivers, such as feeding or even taking them to the veterinary hospital for attention. Next slide, please. Another risk factor is homelessness for those in domestic violence situations. This can be due to full shelters where they can't get in, or they have limited stays, limited capacity. We also know that it takes an average of 7 times for someone leaving a domestic violence situation before it becomes permanent because of multiple factors. A study in Seattle found, with a study regarding homelessness, that 76% reported barriers to resources because of them having an animal, 64% being harassed for having an animal, and then 55% said their pets were designated service or emotional support animals. Next slide, please. Now, there's been studies everywhere about the link. This is going back to the 70s and actually even before then. And this is in the psychology fields, the social studies, child welfare, animal welfare, adult protection services, even in law enforcement, some degree of awareness. But the problem is everybody's working in silos. They're not connected, or they're not looking, or they're just simply unaware. Next slide. And this is where things need to change. Next slide, please. So making those connections, National Sheriff's Association, I believe it was 2017, came out with a statement to all law enforcement that the investigation and considerations of animal cruelty should be on their list of priorities to look at and respond to and support. It's being tracked by the FBI and their behavioral analysis unit. It's actually part of the reporting system. Now they include those categories. Law enforcement is recognizing that there's an advantage in looking at animal abuse or animal cruelty as part of their investigations, but we still don't have connections to all the stakeholders in this whole broad spectrum of issues. We don't have cross-reporting and all those intersectionality points. But veterinarians, we are on those front lines to see the signs. Next slide, please. Domestic violence shelters, less than 10% of them have any kind of pet program in the United States. Most of them are not asking about pets on their hotlines or including that as part of their risk assessment. They may not have safety planning for pets included on their website or even available on their on-site facilities. No foster programs or alternatives for what to do with pets. They may not be tracking what is the exact need of pets within their shelter or in their community. And then they have this fear that if they advertise they're doing something for pets, that they're afraid of being overwhelmed. Next slide, please. The challenges they face is that in their world, it is crisis all the time. They don't necessarily understand the needs of the pets, and they're not connected to the animal community. Their capacity can be an issue. They rely heavily on their volunteers. Their limitations may include their housing, not only the physical structure and space, but there may be regulations that they're concerned about or that they may not meet or prohibits them having pets. Transitional housing from someone moving in from their shelter into temporary housing, there's issues of pet deposits, maybe breed restrictions. Then they are looking at, and some of them are starting to move towards declaring the animal as an emotional support animal so that they're under federal protection to bypass some of the housing restrictions. And then of course they all face funding issues. Next slide, please. The veterinary community, as vets, we are protectors of the animal health and well-being, and we're seeing abuse cases, and we may see indicators of family neglect or violence, but we're not receiving training routinely, either through veterinary schools or through CE opportunities on the recognition of animal abuse or human abuse. But it's critical that the veterinary community is part of the community response plans. Next slide, please. So what are the needs for these pets? Most of them have had minimal to no veterinary care or even education about preventative care or nutrition or behavior. They need vet services day and night. There may be emergency services that are needed. They may need temporary boarding. They certainly need some on-site care where the animals are being housed on the domestic violence shelter side, education opportunities, transporting of pets to appointments, behavior support. Most of these animals have some behavior issues related to living in chronic stress, chronic fear, chronic anxiety. And the vets need to examine these animals looking for signs that they have been abused. Next slide, please. The plans for these pets and domestic violence survivor situations is that we need to plan for some kind of co-housing or co-living. Now, co-housing refers to the animals being housed on the same location, versus co-living is where the animal is actually in the shelter with them. A foster program is always needed because they can't necessarily have the capacity to take in everyone into their physical shelter. And then there's some that don't need to come into the shelter, but actually need a temporary placement or foster home for their animal while they secure more permanent housing facilities. Considerations need to include confidentiality, not only for the survivor, but for the pets. But we don't need to reinvent the wheel or be overwhelmed with how do we even start this, because there's many programs that are already being done out there that have templates that they're willing to share. Next slide, please. So this is the sites that you can access. The Animal Welfare Institute has a safe haven mapping program where you can go on and click on any state or city and find where there are shelters that have programs for pets. The Urban Resource Institute of New York City, Uri Pal's program, they have opened up multiple shelters where they have co-living programs that's been supported by Purina Pet Nutrition. Red Rover, their site has multiple resources on domestic violence and pets, and they offer training, funding resources. They actually administer the grant program from Purina, the Purple Leash Project, to provide funding resources to shelters to create pet programs. Los Angeles SPCA has an online downloadable format program, PDF, called the Animal Safety Net program. And this is a complete foster program that includes PowerPoints for training of foster volunteers. The Safe Pet Canada is a program that has been initiated by the Ontario Veterinary Medical Association, connecting all across the province, of creating resources and programs for placing those pets in foster homes to assist. And then Banfield and Bayer also have created foundations and funds to support this. Next slide, please. The last thing I want to make you aware of is the federal law that was finally passed in 2018 called the Pets and Women's Safety Act. There's another PAWS Act that's different, but this one was 2018. And basically, it is a federal program that establishes grants for emergency, transitional housing, even transportation for domestic violence shelters, for having programs for pets to support those fleeing domestic violence. So that's a whole nother federal potential resource. Next slide, please. And that concludes my presentation. Thank you.
Thank you. Our final presentation, Psittacosis Outbreak Among Workers at Chicken Slaughter Plants, Virginia and Georgia, USA, 2018, is by Drs. Julia Murphy, Marie DePirio, and Christine Zabluski. Please begin when you're ready.
Hi, so this is Christine Zabluski. Unfortunately, Julia wasn't able to get the phone line working, so I'm actually going to present the Virginia and the Georgia part. So I'll go ahead if you want to proceed to the first slide. So on August 31st, 2018, the Central Shenandoah Health District of the Virginia Department of Health received notification by Hospital A that 2 patients, both of whom worked at the same poultry processing plant, had been admitted due to high fevers, cough, and radiologic evidence of pneumonia. This plant is a spent chicken processing plant, slaughtering hens and roosters 65 weeks or older that are used for breeding. Both patients reported that other employees were ill with similar symptoms. By September 4th, 2018, Hospital A notified CSHD of 8 additional employees of Plant A seeking care for similar illness. Influenza testing for the first 2 patients was negative. By September 4th, and based on the clinical assessment, coupled with extrapulmonary features of the illness, such as some patients with hematuria and increased liver function tests, as well as a potential zoonotic contact history, the local health department worked with both state public health and lab officials, as well as the CDC respiratory program, to test patient samples for C. psittaci using PCR. By September 7th, we received our first report from CDC that the samples had tested positive. Next slide. The disease outbreak investigation included an environmental study, an occupational health study, and a cohort study. Samples for both PCR and culture were taken from the plant to assess for the possibility of ongoing worker exposure through their work environment. Samples tested by PCR were positive, with results consistent with Chlamydia gallinaceae, not C. psittaci. And when culture was attempted on 5 samples that were strongly positive on PCR, no organism could be isolated. The USDA employees associated with this plant requested a NIOSH health hazard evaluation, which will be described later in the presentation. Note that the plant closed on 9/8 and reopened on 9/18 once the environmental sample results were known. C. gallinaceae has been recently described and may have a zoonotic component. Although confirmed human cases were culture positive for C. psittaci, we feel cases were infected with Chlamydia psittaci. Next slide. Overall, 50 people met the case definition, with the highest attack rate associated with those who worked in the bird evisceration area. 40 employees, or 28%, reported ever using a mask at work, a practice that was significantly associated with half the risk of illness compared to never wearing a mask. Additionally, people who reported receiving any reminders of PPE usage were at half the risk of illness of those who reported never receiving reminders. While there was no association with high-pressure washing, this could have been because there was a very small number of people who worked in the cleaning crew. Next slide. On September 12th, GDPH was notified that 3 employees of a poultry slaughtering plant tested positive for C. psittaci. The plant was shut down and environmental samples, next slide. The plant was shut down and environmental samples were collected. Next slide. On September 16th, the plant was deep cleaned. Next. And on September 19th, Plant B reopened after all environmental samples came back negative for C. psittaci. Next. On October 1st, we initiated a case control study. Next. 30 cases were identified, 8 confirmed, 12 probable, and 10 suspect. Next. Onset dates range from August 17th to October 22nd, with all laboratory confirmed cases falling between September 4th and October 4th. Next. 57% of case patients were male, which is similar to the controls. The mean age for case patients was 44 years old, with a range from 22 to 58 years old. Next. The most frequently reported symptom was cough, followed closely by fever and then chills. Next. Over 2/3 of the patients, including all the confirmed cases, were diagnosed with pneumonia. Almost half of the patients were hospitalized, and 1 was in the ICU. Next. We found 4 statistically significant risk factors. Psittacosis case patients were 6.8 times more likely to report working in any part of the plant prior to the acid wash and chill tank stage of the process than controls. Other significant risk factors included reporting working on second shift, reporting eviscerating chickens as a job duty, and reporting working for at least 15 minutes in the evisceration area. Next. Although there was not a statistical significant difference in PPE usage between cases and controls, we did find that overall the use of some PPE was poor. According to the employees interviewed, the plant did not require masks to be worn, but it was reported, the plant gets very warm and the masks are a hindrance to breathing. Next.
Hi, this is Dr. Marie DePerio from NIOSH, and I'm going to talk about the NIOSH Health Hazard Evaluation, or HHE. So NIOSH is the National Institute for Occupational Safety and Health, and we're a center within the CDC. So the HHE program is a congressionally mandated program in which NIOSH conducts worksite investigations in response to requests from employees, employers, unions, or other government agencies. So our objective is to determine whether harmful exposures, processes, or conditions exist and or cause injuries or illnesses. Next slide. So NIOSH received this particular HHE request from employer representatives at USDA FSIS to evaluate the plant in Virginia. So while there were no lab confirmed cases of psittacosis among USDA FSIS employees, 2 employees were reported to have had a febrile respiratory illness. So the objectives of our HHE were to identify work practices, processes, and conditions that could facilitate the transmission of Psittacosis to USDA employees and to make recommendations to minimize exposures. And this is a photo of the VDH team and the CDC team. Next slide. So before I move on, I thought it would be worthwhile to describe the chicken slaughter process for those who are unfamiliar. So in first processing, birds are unloaded off crates on trucks, like the photo on the left, then grabbed and shackled in the live hang area, the second photo, stunned, killed, which is the third photo, and then scalded, defeathered, eviscerated, which is the photo on the right, and then chilled. So second processing is where the carcass is then rehung, washed, cooled, and packaged. Next slide. So we visited the plant shortly after it reopened. Our activities included observing work processes, practices, and conditions all the way from the live shed area to the packaging area. We also completed confidential semi-structured interviews with all 6 USDA FSIS employees, along with an epidemiologist from the Virginia Department of Health. I worked with one of our senior industrial hygienists, Dr. Nancy Burton, who determined the general airflow in the plant with special attention on the exhaust and cooling fans. And then Dr. Burton also reviewed the chlorine disinfection procedures and the special disinfection steps after the plant had closed. Next slide. So during our visit, we learned about and observed work practices and conditions that we felt could promote the aerosolization of organic matter, thereby facilitating transmission of Psittacosis in this plant. We focused particularly on the live receiving, the live hang, and the evisceration areas. And we observed the USDA FSIS inspectors handling chicken carcasses, so actually running their hands through the carcasses and then the viscera. Next slide. So we observed, we spent a bunch of time in the evisceration area, and these are just a couple pictures of the USDA inspectors. At this particular plant, the inspector physically inspected each carcass and the viscera by running their hands through it and then deciding on a disposition. These inspectors spent most of their work time in the evisceration line, and all reported getting splashed routinely by chicken material. We also heard from multiple inspectors that there was possibly a malfunctioning vent gun in the evisceration area, and that's circled in yellow on the photo on the right. And basically that is sort of a tool that evacuates the GI tract of a chicken. Next slide, please. In terms of our other observations, the plant did not have a ducted ventilation system. Instead, they had these 5 large exhaust fans in the evisceration room. The photo on the bottom right, you can kind of see the oval in yellow. There's an exhaust fan that is leading directly outside. We also observed several cooling fans across the facility, both that were ceiling mounted, but then a bunch that were portable. And we found out that employees actually moved these fans so that they could blow air directly on their faces because it was really hot there. We found that the plant had conducted deep cleaning with a quaternary ammonia. Also, areas had chlorine solution, and they also used a chlorine dioxide foam. Also in the evisceration area, we observed a metal partition, which is the bottom picture. There was a metal partition that kind of separated the area between the USDA inspector and the evisceration line employee. We noticed that that was present on line 2, but not lines 1 and 3. Next slide, please. So we framed our recommendations according to the occupational safety and health hierarchy of controls. And so that's where, eliminations, so removing the hazard, substituting it, those are the most preferred methods. So in terms of elimination, we recommended that the plant and USDA work with growers and veterinary staff to reduce rates of poultry fecal and bacterial contamination. In terms of engineering controls, which are really placing physical barriers or other engineering methods to control hazards, we recommended that the plant install partitions in evisceration lines 1 and 3. inspect and repair their equipment, and reposition and then also mount the cooling fans so that the employees couldn't manipulate them. Next slide. In terms of some of our administrative control recommendations, these are, workplace dictated practices in the way people work. So exploring methods to reduce the aerosolization of sort of matter in the air, such as considering misting of the birds prior to live hang, things like that. We also recommended that they improve communication between USDA FSIS management, the employees, the plant, and the state health department. We found that the USDA employees didn't necessarily know what was going on with the investigation. We also recommended that USDA instruct their employees to inform a supervisor and seek medical care if they develop symptoms. Last on the hierarchy of controls is personal protective equipment, or PPE. We consider that to be the least effective measure of controlling a hazard because it requires the most employee sort of participation and proper use. USDA had made the decision before we got there to put all of their inspectors in face shields. We had sort of different opinions about the comfort level and the effectiveness of the face shields, so we recommended that USDA offer a choice of different face shields. We also recommended that they provide workers with, their inspectors with nitrile gloves and not latex gloves. Next slide. So that's all I wanted to say about that investigation. It was just part of a multi-agency investigation that involved our state and local health departments, agriculture, USDA, and our CDC partners who are the psittacosis subject matter experts. So I will conclude there, and I think we're going to move to Q&A.
Thanks to all of today's speakers for their excellent presentations. We have time for a few questions, so please use the Q&A feature in Zoom to send your questions. Please name the presenter or topic at the beginning of each question. We do have one question for Dr. Merck. Jen Brown asks, are you aware of any state in the U.S. that mandates reporting of animal abuse to the state government with the goal of identifying households at risk for interpersonal violence?
So the question is if there's mandatory reporting of animal abuse?
Yes.
Yeah, by veterinary professionals only?
I'm not sure, but with the
Okay.
goal of identifying households at risk for interpersonal.
Sure. There's several states, and it's growing. There's several bills right now before legislators across the United States looking for mandatory reporting, one of which is New York and Ohio. But I think there's 17 or more. Is changing rapidly, requiring veterinarians to report suspected abuse. Some have laws asking, I believe it's Indiana, if I got that right, where there's some cross-reporting mandated. Some of the language is buried supporting cross-reporting of child abuse, like if someone's investigating child abuse and they see animals to cross-report, but it's not necessarily in these statutes where it's getting on people's radar that need to be part of that. There is, I believe California has a mandatory reporting of suspected child abuse. So the answer is yes, and it varies, and it depends on who, the different stakeholder groups that it's being impacted by.
Thank you. If there are any other questions, please enter them now into the Q&A box. I will give it just a moment to see. Okay, and for our psittacosis presenters, are there lessons learned from the multi-state cases and how we all became aware?
So this is Christine. So I would say one thing about communication is that this investigation, we had 3 EIS officers that were on the investigation. We had the Virginia EIS officer, the Georgia EIS officer, and the CDC headquarters, who is at Respiratory Diseases Branch. And our CDC officer did a really great job of coordinating communication between all all entities, so all the local, the state health departments, as well as agricultural partners as well. So I think they did a great job of that. One interesting thing that I didn't get a chance to really go into, but there was an occupational nurse on staff at both of the poultry slaughtering plant locations. And so when Virginia first had this outbreak start to occur, the Virginia nurse let the Georgia nurse know that they were seeing this and what symptoms to look for. So the Georgia nurse, as soon as she started to see symptoms, contacted Georgia Public Health right away. And so it was a nice way to get into the investigation early because she did have that heads up and there was communication between those nurses.
Yeah, and this is Marie DePerio from NIOSH. I will say, you know, a lot of the cases that came out of the Virginia plant all presented at the same hospital. And so the physicians there were able to pick up on this cluster of, you know, atypical pneumonia in previously healthy patients. I will say that one of the lessons we learned, you know, I definitely think communication was great, but I think one of the things we've all reflected on is maybe more closer communication between public health and agricultural partners.
Thank you. We have a question for Dr. Burkett Cadena. What are the current elimination strategies for pythons?
Good question. What are the current elimination strategies for pythons? Well, there's really no single coordinated effort. So federal agencies and particularly Everglades National Park and Big Cypress National Preserve will hold annual or semi-annual python hunts where they allow the public to register as python hunters and to go into these national parks and national protected lands, which normally protects every organism in the plant, even invasive species. They'll allow them to enter these federal lands on those days and capture pythons alive, bring them back to a check station so that biologists can confirm that they are indeed pythons, and those animals are then euthanized. There have been other interesting attempts where snake handlers and snake charmers, for lack of a better term, from India and Bangladesh have been brought over for their expertise in capturing snakes. They have captured snakes and they've captured good numbers of snakes, but still it's numbers in the dozens and at most 100 snakes. But we know that there are thousands of snakes out there in these wilderness areas for the most part. These animals are very difficult to find. So capturing these animals using human beings and so also dogs, which are trained to locate these snakes by smell, have been the primary methods thus far to try and eliminate the snakes from very large areas of wilderness. So none of these have been particularly effective at reducing the python population. So yeah, scientists and wildlife biologists and federal land managers are still scratching their heads over that one about what to be done about the python. It's an excellent question. Thank you.
Thank you. And also for you, do you have any sense of the public awareness about this form of encephalitis? And did the Zika discussions last year help spread awareness or compete?
So the Zika awareness, well, let me start with the first part of that question. Public awareness of Venezuelan equine encephalitis virus, which is a very serious form of the disease, which occurs throughout tropical South America and Central America. Public awareness of that is still very, very low compared to viruses like Zika virus, like dengue virus, like West Nile virus. There was an excellent paper that was published a couple of years ago that was titled Under the Dengue Umbrella, where some very clever researchers, not including myself, had gone to actually do serology work on people who had been diagnosed with dengue virus to determine whether or not it was actually a dengue virus infection. And in a majority of cases, it was not actually dengue infection. So these diseases are being misclassified, and they're overwhelmingly being misclassified as dengue virus. So no, unfortunately, Zika virus did not help us draw further attention to Everglades virus or other zoonotic mosquito-borne pathogens like Everglades virus. And public knowledge of this is very, very, very low.
Thank you. And then there is one more for you as well. What is the burden of Everglades virus in South Florida?
That is also an excellent question. What is the burden of Everglades virus in South Florida? Well, no one knows is the short answer, because it is not a reportable disease. So even physicians and other and public health workers who would normally be collecting human serum from suspected encephalitis cases and submitting it to a testing laboratory like the Tampa laboratory, are not aware of this virus. They're not collecting it for detecting the virus, and there is no currently available test for, or widely used test for detecting antibodies to Everglades virus in human beings. So it's likely that if you live in an area where Culex CDCI is common, that the level of prevalence in human beings is fairly high. And what is fairly high? That's usually probably going to be 1 or 2%. But that's only going to be in southernmost Florida, say about Lake Okeechobee southward. So when you get north of that, there have been human cases of Everglades virus confirmed serologically in human beings as far north as Sebastian, Florida. That's even farther north than Vero Beach, which is about midway on the peninsula. So the virus does exist much farther north than the Miami metropolitan area, but we know very, very, very little about how prevalent the virus is in human beings. Good question. Thank you.
Thank you. And for the psittacosis presenters, we have a question. Are there hypotheses to explain why second shift might confer higher risk? Perhaps that may indicate a particular flock?
Yeah. So we do think that there was a reason why only second shift seemed to get infected. So 100% of our laboratory confirmed cases and all but one of our severe cases that had pneumonia all reported working on second shift. The one pneumonia person who didn't report working on second shift, he's actually a first shift worker who did stay over on second shift a couple times during our exposure period. And so we are really highly inclined to believe that whatever shipment of birds was processed during that second shift was the shipment of birds that had psittacosis. So that is what we believe might have happened. Unfortunately, the traceback efforts were not able to find the source flock.
Thank you. And then we have a couple more questions for Dr. Burkett-Cadena. Is the population of cotton rats increasing because of size or taste? If it's size, why were the mice numbers decreasing?
That's also an excellent question. So what's going on with the rodents? Well, we can tell you that Burmese python is indeed consuming rodents in addition to the medium-sized and larger mammals, like the raccoon, like the opossum, like the deer. However, rodents breed explosively. They can have as many 20 pups per litter, and they can have up to 6 litters per year. So basically, they can keep track with the pace of the python's predation, whereas other mammals cannot, particularly deer. Deer take much longer to be able to have young and to rear those young to a reproductive age. So I didn't want to communicate that the rodents are not being preyed upon. They are. However, it seems that their populations are actually a little bit larger than they were during prior to the introduction and establishment of the python. So the red bars for the python, for the rodents in the figure by Dorcas et al. Is actually a little bit higher than the green bar. So I wouldn't say that those data are conclusive. There needs to be more work done on this, but rodents are doing very, very well in southern Florida, despite the python.
Thank you. And one more, in your study of Everglades virus, is there any work being done to look at vertical transmission as a factor for propagating the virus within the mosquito population in Florida? Dr. Burkett Cadena, you may be muted.
Thank you, I was. So that's another excellent question. So vertical transmission is a mechanism by which a virus is passed from a mother mosquito to the eggs, her larvae, and offspring, that when they develop to adulthood, they can still transmit that infection by their bite. Now, this is not typical with most mosquito-borne viruses. A mosquito needs to feed on an infectious vertebrate animal like a bird for West Nile virus, like a rodent for Venezuelan equine encephalitis virus to acquire that infection. So there's not any evidence to suggest that vertical transmission contributes to transmission of Everglades virus. But again, this is another area that there is not a lot of data on. Good question.
Thank you. We've also had some additional questions about sharing slides. If you have other questions for today's presenters, you'll find their email addresses on the ZOHU call webpage for today's calls. Instructions for receiving free continuing education are available at cdc.gov/onehealth/ZOHU/continuing education. The course access code is OneHealth2020. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCE online by April 6th, 2020. A web on-demand recording of today's call will be posted online at cdc.gov/onehealth/ZOHU/2020/march.html by April 7th, 2020. Our next call will take place on Wednesday, April 1st at 2 p.m. Eastern Time. Please send suggestions and questions to zohucall@cdc.gov. For more information and to subscribe to our email newsletter, please visit cdc.gov/onehealth/ZOHU. Thank you for your participation. This ends today's call.